Hello everyone, Namaste. My name is Dr. Sudhir. I am working as a pain management specialist in Hariom Specialty Healthcare Center, Tirupati. I have done my MBBS, Diploma Anesthesia and DNB, and I have done my fellowship in pain medicine, and I have done pain management in cancer patients. Now, as you can see here, all the contact list is given. Phone numbers have been given. Location in Tirupati has been given and shared, and website has been given, and my email ID has been given. You can mail me and tell me about all your issues and problems, and we shall discuss over mail also. And for video consultation, WhatsApp is the best choice, and others also are present through which you can have video consultation, one-on-one video consultation. And regarding social media, we are present in almost most of the platforms through which you can chat with us, and we can have live sessions also. And we are present here. We are available in all these formats, so please kindly utilize all these things. Now coming to pain as such, as you can see here, various pains, and related to pain, what and all things are there. This is a huge group of things. Okay, now question is, what is pain medicine, what is interventional pain management, what is pharmacological, non-pharmacological pain management. Now, pain management or pain medicine, you call it, or pain control, or it's called as alligatry also, is a branch where interdisciplinary approach is used for easing the suffering and improving the quality of life. Now, the words are quality of life and activity of life, or daily activity index. Now, these two things are the ones which are the targets to be improved in pain medicine or using pain management methods. Now, approaches, you have multimodal approach and treatment from one or more clinical disciplinaries. Different approaches are there for acute or chronic, or acute on chronic, acute flare-ups we call it as. Now, multidisciplinary approaches, what's the advantage is different aspects of chronic pain conditions, including biopsychosocial effects of the medical condition of the patient. This reduces pain severity, improves the mood, and overall quality of life is improved, and increased functionality of the patient. Now, as per recent guidelines, this we have adopted biopsychosocial model of pain, and through which collaborative stepped care model is used. Now, first things first, whenever a patient comes with pain, we have to take history, physical examination, and through investigations also we need to come to a proper diagnosis. And through interdisciplinary pain medicine team consultation, collaborative care is done, and mental health and addiction services are also to be utilized if required, as per the need of the patient. Medical organizations and advocacy groups are also encouraged to get involved in pain management. Now, biopsychosocial model of pain management is something you need to know. Biological model, psychological factors, and social factors. So, biological, psychological, and social. Now, biological factors, as you can see here, pain generators, age, injury, neurological, genetic, what and all can cause or aggravate obesity. Now, psychological factors are mood and affect because of pain, or this itself presents as pain. Now, stress and coping from various stress events or events in life, or from pain, trauma, childhood All these things have effect, and social factors, cultural stigma, education, ethnicity, just like that. Okay, so this model is what we have adapted right now, which creates pain, aggravates pain, and for this we use multidisciplinary clinical approach method for treatment. Now, acute and chronic pain. Now, acute pain is actually a physiological response for any painful, noxious stimuli that is sudden in onset and time limited. Now, example, burns and trauma following surgeries in the post-operative period. Now, most cases of chronic pain starts off as acute pain. Okay, and acute chronic pains can sometimes suddenly flare up, called as acute flare ups. Now, as you can see here, acute pain flares may recur periodically in chronic medical problems. Example, arthritis, neuropathies, spinal conditions, low back pain, migraine, multiple sclerosis, trigeminal neuralgia, and complex regional pain syndromes. Now, it's important to know the risk benefit analysis, and it needs to be discussed with the patient's family, or the concerned persons who are related to this. Especially, we need to concentrate upon the opioid exposure which are given for the patient with very much severe pain, and the side effects including nausea, vomiting, and constipation. That is why multimodal non-opioid approaches are encouraged more. And along with that, low dose, if required, opioid therapy. Now, opioids are effective for treating acute pain or acute flare-ups of chronic pain, or in post-surgical patients. Now, patients who have a history of tobacco abuse, alcohol, substance abuses, anxiety or depression, other pain conditions and comorbid conditions have increased risk of chronic opioid abuse, or chronic opioid usage, you can call it as. So all these patients have got high risk of becoming dependent upon opioids. And as you can see, this is the whole model in which acute pain or acute flare-ups of chronic pain or chronic pain are managed using multimodal or multidisciplinary using, and after assessment of risk, stigma, access to care, education. These are the factors which actually plays a role in providing all these kind of treatments. Now, medication is the first one, restorative therapies, interventional, behavioral, and complementary approaches. Now, we'll go through each one in coming videos. Okay. Now, pain management team involves pain practitioners, pharmacists, psychologists, psychotherapists, occupational therapists, nurses, dentists. So, team approach is plays a very important role, and treatment approaches for chronic pain as such, it is same as previously what you saw: medication, restorative, interventional, behavioral health, and complementary plays an important role. Now here these are example. This is an example, clear-cut example of four patients who have entered the pain clinic. Now all the four patients have different levels of pain, acute pain or chronic pain, or acute flare-up of pain, or acute on chronic pain, or chronic pain suddenly became acutely increased. So this once a patient enters, now the physical diagnosis is done, basically history, physical examination, and then investigations if required, and then you diagnose the condition, and you take the approach of biopsychosocial approach, and then the relationship between the patient and the doctor is what, and discussion about what to do for this kind of pain, that is what is the most important. And the tools which are available are drugs as such, medications, now TENS, yoga, epidural steroids, gabapentinoids. There is a whole bunch of things given here, which is nothing but previously I have told various therapies which are there, various steps. These are all those are all present here. And after trying out all these things as a combination for different patients, we have different combinations. Now patient A is ready to get NSAIDs, yoga and nerve blocks. Now patient B, for his condition, after evaluation, short term opioids is enough, behavioral therapy and physical therapy. Now patient C, for her condition or his condition, acupuncture is more important, trigger point injection or self management itself. And patient D, gabapentinoids, tai chi and epidural steroid injection. Now all these patients are not getting the same type of treatment. They are given based upon the type of treatment and multidisciplinary approach, using the biosocial cycle approach, and all the different types of modalities of treatment what we saw previously, all included. It's a package of treatment which gives as a target the best result, increasing the quality of life of the patient. Now challenges are, first things, communication between the healthcare provider and the person who is experiencing the pain. It is very difficult to recognize and describe the intensity of the pain. It is only the relationship between the patient who is suffering with pain and the healthcare provider that the intensity of pain can be caught, and then with respect to that, treatment can be planned. Now there is a risk. Now pain as such is a physiological response, we told. So pain occurs in any condition where nociceptive stimuli is there. Now acute and chronic. Now if pain occurs as a primary response, okay, that's fine. Now pain occurs because of secondary diseases already present in the patient, but the outcome of it, the feature of it, symptom comes only as pain, then it is difficult. So we need to have a broad approach, broad thinking, and we need to really dig into history and physical examination part, wherein we have to catch whether it's because of underlying systemic conditions. Now goal is to identify the amount of treatment, amount of medications that are required or type of medications that are required. Another problem is pain is bodies, as I explained already, because of deeper pattern, deeper systemic uh, diseases, patient presents with pain that we have to catch with a lot of intelligence. Okay, now that's all about what is pain medicine and its branches and how it's treated and the models and therapies. Now this is again a contact list. This is in order to WhatsApp me and WhatsApp call. This is the phone number you need to use, and location, website. Mail me please about your this thing, and we shall chat together in various formats also, social formats. Thank you. Take care. Okay. Bye.